Have you ever seen one of those complex medical scans and wondered, how on earth does a doctor make sense of that? Well, today, we're going to pull back the curtain. We're taking a deep dive into the world of radiology to see exactly how an expert reads a chest CT scan, which is one of the most detailed and information-packed images in all of medicine.
So let's just jump right in. Take a look at this. It's a single slice from a CT scan of a human chest. You got lungs, the heart, bones, all these blood vessels. It's an incredible amount of detail. Now, the big question is, how does a doctor find one tiny, potentially life-threatening problem hiding somewhere in this maze of grayscale? I'll tell you this much. It is definitely not a random search. It's a highly skilled, systematic process.
And the first secret to unlocking everything hidden in these images, well, it involves a special ingredient, something that makes the invisible visible. And believe it or not, it all comes down to perfect timing. That secret ingredient is something called intravenous contrast, or IB contrast for short. You can think of it as a special, harmless dye that's injected into a patient's vein. It's like a temporary tracer that flows through the bloodstream, and as it does, it lights up the body's internal plumbing, all the blood vessels and organs, making them pop out bright white on the CT scan. Now here's where it gets really clever. The timing of the scan after that injection completely changes what you see. So at about 15 seconds, boom, the contrast floods the pulmonary arteries. Those are the big vessels going to the lungs. Wait just a few more seconds, and now it's lighting up the aorta. And if you wait about a minute, it's seeped into all the soft tissues throughout the body. So why is this so important? Well, radiologists use this timing strategically. It's ingenious, really. If they're hunting for a life-threatening blood clot in the lungs, they have to scan early, right at that 15-second mark, to catch the contrast as it rushes through. But if they're looking for, say, a tumor or some other issue in an organ, they'll wait a little longer. It's all about tailoring the scan to answer a very specific question. Okay, so now that we get how we can see things so clearly, let's talk about what we're actually looking at. We're going to start right in the center of the chest, in a really important area with a kind of fancy name. This area is called the mediastinum. It's basically all this space sandwiched between the lungs. The best way to think about it is like the body's downtown core. It's this super busy hub that contains all the critical infrastructure, right? You've got the heart, all the major blood vessels coming and going, and the main airways. It's prime real estate. And this is where things get fascinating, because in radiology, location is everything. For instance, if a radiologist spots a mass in the very front part of this downtown core, a classic mnemonic called the terrible T's instantly pops into their head. This little trick helps them narrow down what it could be. Is it from the thymus gland, the thyroid, maybe a teratoma, or could it be terrible lymphoma? It's a perfect example of real-life medical detective work. So let's zoom in on the most important residence of that downtown core, the engine room itself. Of course, we're talking about the heart, that tireless pump, and the aorta. The aorta is the body's main superhighway for blood. It takes all that freshly oxygenated blood from the heart and distributes it everywhere, making this beautiful arch right over the top before it heads down through the chest. But, radiologists don't just eyeball these structures. They measure them with incredible precision. They know that a healthy pulmonary artery should be less than 3 centimeters wide, and the ascending aorta less than 4. If a vessel gets bigger than that threshold, it's a huge warning sign, a red flag that something serious might be going on, like an aneurysm. Okay, so we've got the right timing, and we know the key anatomy. Now, for the most important part of all, how do they put it all together to make sure that absolutely nothing is missed? Reading a full CT scan, which can be hundreds of these individual image slices, is not a treasure hunt. It's not about randomly looking for something weird. It's a systematic, rigorous process. And honestly, the best analogy is a pilot's pre-flight checklist. It's a routine they follow every single time to guarantee nothing is overlooked. And here's a simplified version of that very checklist. They start with what's called a scout image. It's like a quick map of the whole area. Then they systematically move through the mediastinum and the heart. Then they check the lungs, piece by piece. After that, the bones of the rib cage and spine. And finally, they even take a peek at the top of the abdomen that's visible in the scan. And when I say comprehensive, I mean really comprehensive. They're not just looking at the big-ticket items like the heart and lungs. The checklist forces them to examine everything: the muscles of the chest wall, the fatty tissues, and even parts of the lower neck, like the thyroid gland, that happen to be in the picture. The level of detail here is just amazing. They know exactly where to look for chains of tiny lymph nodes, which can be some of the earliest signs of disease. They check very specific hiding spots, like this little nook called the AP window, which is tucked right in between the aorta and the pulmonary artery. Most people would never even know it's there.
And get this, the search doesn't even stop at the chest. The checklist makes them carefully examine the upper parts of any abdominal organs they can see, like the top of the liver, the spleen, and especially the adrenal glands. Why? Because sometimes that's the first place certain lung cancers might show up. It's this level of thoroughness that can lead to absolutely critical, life-saving incidental findings.
CC, a CT scan is so much more than just a picture. In the hands of a skilled expert, it's a story. And the key is knowing how to read it, using the right timing, deep anatomical knowledge, and a rigorous checklist from the first line to the very last. The secret isn't just seeing, it's knowing exactly how to look. Thanks for joining me on this incredible journey inside the body.